Knock, knock. I'm Sierra, I'll be your student nurse. Pulling the curtain for privacy. Washing my hands. Can you tell me your name and date of birth?
Joe Smith, 10-5-85.
You allergic to anything?
Sulfa.
Okay, I'm putting on gloves, so don't forget. I'm gonna verify that information with your wristband. Okay. So we won't be giving you anything with sulfa today. So that's good to know that you're allergic to that. Okay, first thing I'm going to check is for any signs of phlebitis, and I don't see any redness. Are you having any pain here at all?
No.
Okay, so that's good. And then I'm going to check the date on when the IV was put in, and it was just put in today, so that's awesome. Otherwise, we would do it every 96 hours or which is every 4 days. So then I'm going to come over here, and I'm going to do my first check. So I'm going to check the medications to my MAR because I have a doctor's order to hook up an IV to you. Is that okay?
Yes.
Okay. So I'm just going to check the papers with the MAR to make sure that they match. Okay. And then I'm going to check to make sure that my medications match my MAR, and it's 0.9 thousand milliliters, 0.9 thousand milliliters, 10 milliliters, syringe 0.9. Okay, so those are right. Then I'm going to just make sure that everything is intact. I don't see any discoloration or crystallization. And this one also looks good. So they're both not expired or broken open in any way. And then I'm going to do my second check. So 0.9 thousand milliliters and 0.9 10 milliliters. Okay. Then I'm going to do my 5 rights, which is right patient, right med, right route, right dose, right time. And then I'm going to do my third check. So 0.9 thousand milliliters, 0.9 10 milliliters. Okay. So then after I do my third check, I'm just going to check my tubing to make sure that it is not broke open and that it is all intact and not expired, which it's not. So I would then open my tubing and bring it over, just check it out, make sure everything looks good. I would get a hold of it here. Okay, so then I would bring this up close to the little port to make it easier to work with, and I'm going to clamp it shut. Okay, so there's that. Then I'm going to, it would be, today it's going to be 100 milliliters an hour or 16 drops per minute. And I'm going to bring the bag over. And so I'm going to spike my bag very carefully. Make sure I don't touch either end. Okay, so spike my bag. I'm going to hang it. Okay, so then I'm going to squeeze water out until it's about half full. Okay, and then I'm going to take my ports and keep them upside down. And then I would release the water just till it went past this first one. I would close it, flick it, open it till it comes past the second one, flick it. I'm getting rid of any air bubbles, and then I would open it and let excess water and air drip out of the end. And then I'm just going to set this aside. Okay, and then now I'm going to clean the end of my port for 30 seconds. So You need to do it vigorously. You want to make sure that there's no chance of any bacteria since it's going straight to the bloodline. So 30 seconds. And then I'm going to take the lid off of this. And then thumb to thumb, I'm going to connect them. And then I'm going to aspirate. And I do want to see blood because I want to make sure I'm in the vein. And then I'm going to do the push-pause method. So you just push and then pause, push and pause. And while I'm doing this, I'm checking for any signs of infiltration. You don't want the skin to bubble up, and in older people you would check underneath as their skin elasticity isn't as good. You don't want signs of that. It means it's going in the tissue versus the vein. So then I'm going to remove that and remove the lid off of this one. And then without touching the ends, I'm going to go thumb to thumb and connect those. Okay. And again, it's going to be 16 drops a minute. So I would watch here on my watch just to make sure that it is in fact coming out. 60 drops a minute, adjust it accordingly. I'm going to tape the IV to the arm just in case it were to move, since people move their arms. I'm going to label my tubing with my name, initials, date, and yeah, time. And is there anything else I can get for you at the time?
Nope.
Okay.